Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Is exercise related to fertility, and can over-exercise affect your fertility potential? Let's discuss that. We know that it has been established exercise has a very good benefit for maintaining healthy weight and cardiovascular activity. We know for a fact that exercise is very important for overall health and well-being. Exercise helps in maintaining healthy weight and proper body functions, and not to forget cardiovascular activity. However, when we talk about female fertility, over-exercise may have detrimental effect on your reproductive potential. How's that? Well, the energy that you consume by way of food is enough for your daily activities. Your daily requirements of metabolism are taken care of by your daily intake of food. But when you exercise more than your daily intake, what is required by your body is lesser than what you are spending, then you get into something called as energy deficit. That is when your body is using all the energy for important functions, and the backseat is taken by reproductive function, such as hormonal disruptions are common, ovarian dysfunction is common. What basically happens is that the hypothalamus pituitary action, this is basically the junction where signals are given to various parts of the body for proper functioning. So this junction is affected, therefore hormonal activity is also disrupted. And by hormonal I mean estrogen, progesterone, FSH, follicle stimulating hormone, luteinizing hormone, all these are also severely affected when we talk about excess exercise. Well, a BMI of 20 to 24.9 should be maintained for optimal fertility and regular ovulation. Anything that is reduced from this or more than this is not good. So about 17% of body fat is required for proper periods, and about 22% is required for maintenance of ovulation. So when you are having periods, there is a good blood flow to your endometrium. For that you require energy, proper functioning of hormones, and when you are ovulating, proper hormone should reach your ovaries so that you ovulate properly. Now, exercise associated menstrual disorders are common in these women who are into rigorous exercising. What basically happens is there is a spectrum of effects of these exercise associated menstrual disorders. There could be irregular periods or a huge gap between two periods. There could be ovulatory disturbances, there could be thyroid issues. All these are associated with vigorous exercise associated issues. Specifically, when we talk about the issues related to exercise related menstrual disorders, there is a luteal phase deficit. By that I mean that when the embryo is ready and it reaches the endometrium is not ready for implantation. So that's a very important thing. There are low levels of progesterone. Now, progesterone is a very important hormone when it comes to again implantation of the embryo. So that's a very critical thing when we talk about vigorous exercises. Hormones responsible for ovulation, like I said, are also affected. Now, aerobic exercise for more than 7 hours per week can disrupt your ovulatory cycles. Vigorous exercise might decrease your fertility even in women with normal weight. So this is something that's very important to remember. Moderate exercise for more or less than 5 hours per week is what we are talking about when we want to maintain a regular fertility potential in a woman. And strenuous exercises for more than 4 hours also can decrease your success rate. These are all proven facts. So what are the recommendations? If you are into vigorous exercise, try to maintain it less than 4 hours per week. That way you're not exceeding what is required by your body to maintain a perfect hormonal balance. You can replace these strenuous workouts with moderate exercises. Like if you're doing too much gymming, you can replace it with light walk or yoga or such things which will decrease strenuous activity duration. And if you're overweight, yes, exercise will definitely improve. Even your 10% decrease in your body weight can help you improve your fertility potential. If your BMI is reduced and you're not able to achieve pregnancy, if your doctor will ask you to improve your BMI by increasing your intake. When you do that, definitely your fertility potential will also improve, because not only your daily activity will improve by way of your increased normal BMI, but also your hormonal imbalance, which is caused due to this energy deficit, will come back to normalcy, and then ovulatory problems and problems associated with the endometrium will also be sorted. Thereby, you can achieve pregnancy faster. If you want to understand more about this, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.